Do you have an independent mind? If so, I hope you'll subscribe to my YouTube channel. Just click on the subscribe button, ring that little bell, and stay up to date with my daily content. Thank you.
How do we reach the people who have no interest in getting vaccinated? I think that's the question that is raised by President Biden's announcement yesterday at the White House, as well as the announcement by the CDC relative to these new guidelines, recommendations for mask wearing. You probably saw that the president came out on the north side of the White House, the front door, if you will, wearing a mask. When he approached the podium, he removed his aviator shades as well as the mask, gave remarks, didn't put the mask back on. That was the whole point. Part of a drill here to try and incentivize people who are unvaccinated as to what life can look like should they get vaccinated. And similarly, the CDC published guidelines yesterday where they have two categories, one for the fully vaccinated, one for the unvaccinated. And in a series of diagrams, they show you whether you are safe, less safe, least safe in a variety of situations. What I took away from the CDC guidelines, having reviewed the website, is that if you're fully vaccinated, and I am, you can be outdoors not wearing a mask unless you're in a very large group setting. That's my gross simplification of what I took away from the CDC guidelines. And the question is whether this is going to work and whether this will provide a sufficient level of incentive for the unvaccinated. I have a very bright friend. His name is Shane Inspector. He is a law professor and noted trial attorney. He teaches law students at Hastings, Berkeley, Stanford, and Penn. And he sent me a note early this morning that said, yesterday's reported daily vaccine total was the lowest in 3.5 weeks. And though the J&J vaccine has been reapproved for 5 days, there are few people reported to have gotten it. He then pointed out to me that the local ABC affiliate here in Philadelphia showed footage of the Pennsylvania Convention Center where for the last several weeks, people have been very deep in line waiting for vaccination, but now far less so. We've reached a tipping point in southeast Pennsylvania that frankly has already been reached in other parts of the country where supply now exceeds demand. And so, anybody who wants to get a vaccine in my part of the world and probably your part of the world, now they can do so. This was not the case up until recent. Several weeks ago, I had the experience, TC, my producer, had the experience of going to a variety of websites looking, hoping to be able to get an appointment for a vaccination. That has all changed. So anybody who wants it can now get it. How do we incentivize them to get a vaccine so that we can all have life return to normal? And that's the subject of an essay that my friend Shane published at smirconish.com today, in which he says, without a better carrot or a bigger stick, Americans won't get vaccinated and we will suffer more death and dislocation. We can't expect people reluctant to get the vaccine to change their minds without more information about where we are and where we're going. And he then says that there's a need for the CDC to answer some very specific questions. For example, if vaccination is not required or rewarded, will we ever beat the virus? And if so, when? How about this question? How low must confirmed COVID cases go before we should be permitted to go back to work, not wear a mask, and not socially distant? How much is the slowing of vaccination rates costing the United States in lives, hospitalizations, confirmed COVID cases, school missed, healthcare not delivered, and jobs lost? And would vaccine passes help? All of these questions he thinks the CDC, and I think he's right, the CDC needs to address squarely so that people who are unvaccinated, as well as those who are vaccinated, but particularly unvaccinated, know and can make decisions based on that information, hopefully leading them to decide to go ahead and get a vaccine. One objection is that vaccine passes are coercive. He points out we require childhood vaccinations for a variety of maladies already, and permitting a medical or religious exemption for the COVID-19 vaccine safeguards an appropriate level of personal freedom. So the question raised by all of this is whether it's enough. The president made his announcement. The CDC made an announcement. Is it enough to incentivize the folks who are not vaccinated and not desirous of a vaccine, or do we need something more, a better carrot or a bigger stick?